Are you dealing with back pain? Maybe it's something that just started like in the last 24 hours, or it could have been something you've been dealing with for months, and for some people even years. You go in, you complain about your back hurting from time to time, and every time you do, you are only treated for back pain. What if I told you that most low back pain actually is caused by other areas of the body? The back is just a symptom. Today, we're going to talk about that. 3 things you can do to identify what other parts of your body could be affecting your back, and why so many of the traditional treatments that you've already gone through or may go through only last temporarily. So stay tuned. All right, don't forget, my new book is coming out September the 1st, and so we want to make sure that you get on Amazon. You can go on Amazon, look for Stretch and Release by Butch Phelps, and you can get this book and start to learn. It's a great book. It's a manual. You can start to learn how to use this and help yourself. And by the way, do me a favor. I've been looking at my analytics, and I see that about 85 to 90% of you are watching my videos, and I'm ecstatic about that. And thank you for doing that. But I want you not to miss any of the upcoming videos, because I'm going to be sending videos out every week, and those can be helpful for you. So make sure you subscribe, but also ring that bell so that you will get notifications when a new video comes out. You can stay up to date. And as always, please, please, please leave me comments. Let me know if it's working, or if it's not working for you, let me know, and maybe I can give you some ideas and suggestions of make it work for you. Thank you. Welcome back to the Muscle Repair Shop. Today, we're going to talk about something that affects at least 80% of every person on this planet at some point in their life. For some of you, it's a persistent, chronic, nagging thing that every time you try to do something, your back goes out. Some people have suffered with it for months. Some people have suffered with it even years. And they've gone to doctors and physical therapy and chiropractors, and they've taken medications, and they've worn back braces. Today, we're going to talk about what other areas of your body are most likely affecting the pain in your spine, and why most traditional treatments fail. And we're going to give you 3 things that you can do to help identify those other areas in your body. So let's dive right in. Most of the time when I work with someone who has low back pain, my question that I get asked them, or questions I should say, is what are you doing that causes it to hurt the most? What happens when you sit down for long periods of time? What happens when you stand up for long periods of time? How does that affect your back? And those questions are important because it will quickly tell me what part of the body I need to be looking at to try to alleviate that pain. So what happens is that when you are doing things like sitting for long periods of time, let's say you have a job behind a desk, you are sitting in a position that you're putting the muscles in the front of your thighs and in your inner thighs in a shorter state of being. And so if you think of those muscles as rubber bands, for instance, the longer you're sitting there, think about taking a rubber band and you're twisting it and twisting it and twisting it. You notice that as you twist that rubber band, it gets shorter and shorter. So the idea here is that as I'm sitting there for long periods of time, I'm constantly tightening the tension in the muscles on the front of my thighs and the muscles on my inner thighs. Well, when I start to stand up, then as I get into a standing position, I'll start to feel a little twinge of pain in my low back. If that twinge of pain is more to the outside of my low back, chances are the muscles on the front of my thighs, the quads, are causing that pain. If when I stand up, that twinge of pain is in the middle of my back, the chances are it's on my inner thighs. Now you have 4 muscles on the front thighs, the quads, and you have 4 muscles on the inner thighs, and then you have 3 muscles on the hamstrings, and we'll get to them in a minute. But when you stand like that and you feel that pain, that pain will be persistent. And if you notice that when you sit down, the pain stops, now you get a clearer picture of what could be causing that pain. So the way to think about that is, imagine if I gave you 2 giant rubber bands and I said to you as you stand there, turn the loop where you got one end of the loop on the floor, put your feet in that loop, reach down and grab the upper part of that rubber band, and you'll notice you have to bend forward to grab that upper part of the rubber band. And then as you try to stand up, notice the tension from the rubber band, that how it causes the muscles in your low back and hips to have to tighten to pull yourself up. And you realize that if you release the tension in your back, it'll just pull your body forward again. That's really what's happening in your body. Now, for most of us, the way we're trained, of course, is that you go to the site of the pain. That's the first thing. Now, when you are standing a lot, and especially if you're slightly overweight with a belly, you'll notice that most people, when they stand, they tend to pull their butts inward. And to do that, they have to tighten their hamstrings. And so when they tighten their hamstrings, now when they try to sit down, they're extending those hamstrings, and there's too much tension there for them to extend. So in a seated position, the low back will hurt as well. And when they stand up, it goes away. So what we want here is to understand that the muscles in the thighs, they are coming in from below the knee and coming up and connecting into the pelvis itself. And whatever area of the thighs are tight, it will tilt that pelvis forward or backwards, but that tilting then actually puts more compression on the vertebrae in the lower spine. Now this over time can lead to things like pinched nerves, bulging disc, herniated disc, disc degeneration in your spine. So it's important to be able to actually get that pelvis then to come back in underneath. Well, that's going to lead us right into why do most traditional treatments that we try last at best a short period of time. So let's start with the chiropractor. So a chiropractor goes in, he or she sees the pelvis is out of alignment, either front to back or side to side, and their job then is to put that pelvis back into place. And when they do that, you feel wonderful for that period of time. The problem is when you leave his or her office and you go back into your life, you're going to resume the posture that you had before. You're going to resume the things that you did before that put the tension back in the muscles that literally negated the work of the chiropractor. You go to physical therapy, they're going to look at it and go, well, if we strengthen your back here, we strengthen your hips and strengthen your abs, that's going to be able to hold you up. That is true on a short-term basis. The problem is go back to those large rubber bands. You're holding those muscles through strength as tight as you can, so those muscles are constantly tightening in your back and in your hips because they're fighting with the muscles on the front side. And over time, the muscles in your back and hips, no matter how strong you are going to fatigue. So it would be like me giving you a 10-pound dumbbell and say, look, I want to train you to hold this out here for 8 hours a day. Probably not ever going to happen, because at some point the arm will start to fatigue out and it'll just drop down. Same is true for the muscles in the back and the hips. Medications, injections. Injections are just stronger doses of medication, getting it quicker to the site of the pain. Their job is really to block off the nociceptors and proprioceptors that sends messages to the brain that says, my back hurts. So you haven't really changed anything physically, you just numb the pain. So it'd be like going to your dentist with a toothache and he's just giving you a shot of Novocaine or lidocaine to numb the pain and then send you home. He didn't change anything physically, he just numbed the pain at that point. So these are the reasons why typical things like that have a problem. Now, even with surgery, you get to the point that you have a bulging disc, you have a herniated disc, and they want to go in and solve it from a surgical standpoint. They can solve that damage and take that pain away temporarily, okay? The surgeon did their job, did a wonderful job, did everything right, they didn't do anything wrong. But the problem is you go back and you resume your posture, you resume your life, you resume what you're doing, and now you start to bulge or herniate a disc above or below the one that was just repaired. So really and truly, it's you as a person in resuming your posture, resuming your lifestyle, that's negating the work of many of the healthcare practitioners who do a wonderful job with the human body. So what can you do about that, and how can you help yourself? Well, there's three things here that you can do to help identify what's causing the problem, and they're easy to do. First, you'll lay on your bed on your back, and you can do one of two things. As you lay there with your legs straight out, you may notice that your back starts to hurt as you're laying on your back. However, if you slide your feet up so that your knees are pointing towards the ceiling, you'll notice that the back pain may go away. Now, you can also do it with putting a pillow underneath your knees, lifting your knees up above your hips, and you will notice that in some cases, your back pain will go away, especially if you notice that when you stand for long periods of time, your back hurts so much that you just need to sit down somewhere. So what that's telling you is that the muscles on the front of your thighs, the quads, are tight, and you can put that pillow under your knees, or you can lift your knees up like that, and you take that tension off the muscles on the front of your thighs. If when you are sitting down and you feel back pain, but when you stand up, the pain goes away, now what happens is that you're taking the tension out of the hamstring. So when you sit down, you're increasing the tension on the hamstring, which is pulling the pelvis backwards, which is increasing the compression on the front side of the lower spine and putting pressure on the nerves and the disc there. And so when you stand up, you take that pressure back off. And so that will show you then that that's part of the problem too. Now, sometimes the pelvis can go from side to side. Here you can take, and I would actually take a level, and if you have a full-length mirror, and draw a small line across the mirror that's level about height of your hips. And I would sit there and look like you can do in your underwear, where you can really see your pelvis there, and see if your hip is level to that line. And what you might find is that one side is dipping a little bit more than the other side. So what happens is you have muscles on each side of your hips from the top of your pelvis to the hip joint itself, called tensor fasciae latae, or TFLs as they're commonly called. Those little muscles help you when you're walking. So in other words, as you walk and take a step forward, they expand out, but then as the leg comes behind you, they will contract. And so what you can do there is you'll notice that you may have pain, let's say on the left side, but you might notice that the right side is dipping more than the left side. And what happens is the muscle on the right side will go into a tension, a tight tension. And as it does that, it tilts that pelvis downward towards the right. The brain is trying to keep you balanced, so it's going to contract the muscle on the left to try to pull you back to even. That will cause the pain to happen on the left side, even though the cause is over on the right side. So there are things you can do to correct those situations, and I'll put the link to those stretches down below. The quad stretch, if you find that laying on your back is too painful, lifting your knees either with a pillow or just, with your legs, takes that out, then the quad stretch is going to be the place you want to go. If the pain is more to the middle of your back, what I call the medial hip thigh stretch for the inner thighs is easy to do. You can do that one as well. And for the hamstrings, I'll give you the stretches for that, and I also will give you the stretches for your calves in the description down there. Follow those, and that will help you when you go to stand up to be able to stand up without pain or sit without pain. And then, of course, the last one I'll give you in the description is for the tennis ball. And do it against the wall, standing sideways. And so don't do a cue ball. Don't get any fancy ball that vibrates or sings to you. Or forget all that. All you need is a simple tennis ball. I think I get them three for $3 or $4 or less than $5 at the local grocery store. And that'll be fine. Put it in a sock, and I'll explain in the video why that's important. But depending on where you feel the pain and what you're doing will determine which one of those stretches you want to do. I would, no matter what you have, I would always stretch my calves. I think that's the most important stretch in the human body. But try those, see if it works. Let me know by leaving comments inside. If you have any questions, please, again, send your comments. Don't forget to subscribe. We have lots of people here that watch but don't subscribe. Don't forget to subscribe. Ring the bell so that you can get a notice of when a new video comes out. For now, see ya. I hope you enjoyed this last video. Be sure to click on the video here to my left and enjoy.